Hey everybody, Saul Marquez here, and welcome back to the Outcomes Rocket. Today I have the privilege of hosting Dr. Jay Bhatt on the podcast. He's a physician executive, internist, and public health innovator. He serves as a managing director of Deloitte Center of Health Solutions and the Deloitte Health Equity Institute. He's just an incredible leader in the business. Today we're going to be talking about health equity, innovations in the space, and just really things that you should be thinking about in the industry. Dr. Bhatt, thanks for joining us.
Saul, thanks for having me. It's wonderful to be here.
Of course. Yeah, and it's a pleasure to get on with you. You are calling in from a conference, right?
Yeah, we're having a discussion with tax leaders and the industry, life science and healthcare, about what are some of the emerging issues that are in the market and what are implications for their role and their relationship with the C-suite and boards. And so it's been an interesting conversation really about macroeconomic trends, health equity, sustainability, digital and AI. You know, we got this Gen AI thing that folks are talking about, and it's really interesting. There's also some of the pressures on the industry around some of the regs and actions that organizations have to engage in, but it's been great. I'm really energized by the conversations and the interest, in the industry to innovate towards a mission of delivering equitable, affordable, quality healthcare, and I'm really excited about it.
And you were a physician for a while, then came to industry. Tell us about that. Like, what made you make that move?
Well, I've always been in this hybrid of clinical medicine, industry, policy. And so my career started, after fellowship in geriatrics at University of Michigan, go Blue, as a public health leader in the city of Chicago. So as a managing deputy commissioner, and really thought a lot about implementing our Healthy Chicago agenda across traditional public health and non-traditional health issues like the drivers of health, food, housing, transportation, spaces for physical activity, addressing sustainability. Kind of this idea is that health in all policies. And then also work to bring healthcare and public health and community-based organizations together. This is right after the Affordable Care Act. And this notion of what are opportunities to improve health more holistically, and you got to get these stakeholders work together. Like I say, health equity is everyone's business. And then we drove innovation, around redesigning traditional public health functions using data, technology, analytics, machine learning, natural language processing. So, for example, predicting which restaurants are most likely to have the risk to the public much earlier than traditionally identified, and impacting the situation where pregnant women and children are exposed to lead and trying to get out in front of that, or connecting people to services that were at risk of deteriorating chronic health conditions. So, breast cancer, colorectal cancer. So there's a really interesting effort. And then I got involved in the hospital world, in State Hospital Association, Illinois, and then Chief Medical Officer of the American Hospital Association. And then I worked with a Medicaid ACO and a Medicare Advantage health plan, really focused on historically vulnerable and historically marginalized populations, and came to Deloitte last February, and really excited about leading our research and insights agenda in life sciences and healthcare, and our work in health equity, not only in working with community-based organizations to help advance health equity, but working with our businesses, our clients, because we say that health equity is not just a moral imperative, an economic imperative, and that you can create value if you lean into it and have better outcomes. And so I still practice medicine at a community health center out of South Chicago.
You do?
Yeah. It's,
nice.
I see patients there,
Cool.
and it's really wonderful. I love taking care of patients. So it's one-on-one and families that you can impact, but the work at Deloitte can impact millions. And so that's what I get jazzed about impact at scale. And I think Deloitte's been doing that and well-positioned to continue to do that, and really a tough environment, but a really exciting opportunity to shape healthcare and life sciences for the future.
Where do we start, right? I mean, there's a lot we could cover here on on the health equity side, I think it might be worth starting there.
Sure.
So what have you seen that's making the biggest difference in the space in health equity through the lens of health and life sciences?
Sure. Let me give you a little bit of backdrop of the macroeconomic outlook. I think in the industry players are generally challenged with some pressures, cost pressures, operational pressures, and they have focus on operational efficiency and excellence. AI capabilities and adoption are growing with the potential to solve challenges facing the healthcare industry. And a little teaser is we've got a great piece coming out next week on consumers and their view on AI, as well as what the implications are for healthcare and life sciences companies and their executives making strategic decisions. So that'll be interesting because it has a health equity perspective to it. The costs of inequities continue to grow at $320 billion per our analysis today, and $1 trillion in 2040 if we do nothing different. So inaction is not a choice. We've got to have our efforts direct impact on affordability, quality, access to care, and addressing the drivers of health. We're seeing more, interest. It's still a priority for executives from our recent data. It's still going to be something that both health equity leaders and life science and healthcare executives think companies will invest in and grow their investment in. And then we also see health and non-health system actors investing in digital health, really blurring the lines between the different industries: consumer, retail, tech, healthcare. So I think that's a really, really interesting opportunity. So on health equity, at Deloitte, we define health equity as a fair and just opportunity for every person to fulfill their human potential in all aspects of health and well-being. If you think about person's holistic health needs, caring for things that impact people's health, 80% of that is impacted by your access to healthy food, for example, or your ability to be in a safe community, or ability to have a connected community, or transportation access, the healthcare needs you have. And then economic, we see that there's a wealth gap equals a health gap. I think if there's, a view on where we are with life expectancy, we are reaching 1987 levels of life expectancy.
That's crazy, man.
It is. It's just unimaginable,
I just can't believe that.
right? In the country that spends so much on healthcare, yet our outcomes aren't as good. And so what we offer in our recent piece, Employers Catalyzing Healthy Aging, is a more optimistic view, a view that we can, if employers lean in and the healthcare ecosystem works effectively together, to the point that health equity is everybody's business, is that we can get nearly 20 years more of healthy life for everyone in America. And that's a really optimistic view. We can close the life expectancy gap, but we've got to center health equity as part of how we strategically operate as organizations, financially operate, and in all of our businesses. And so we have this 4 domains of action approach. What are you doing in your own house for your employees, your workforce, as it relates to health equity? What are you doing through the lens of your products and services? You can either contribute to a health footprint, similar to the net zero carbon footprint, or you can contribute to exacerbating health inequities. And what are you doing in the community? And then the ecosystem, which is vendor supplier diversity, some actions around local fragmentation that you bring that together. So we did this in Philadelphia, public-private sector coming together around maternal health, and we continue to do that in other parts around the country. But, access, stigma, lack of trust, other barriers impact health outcomes, and literacy, which is, the ability to understand. And it's not one size fits all. Got to help folks at different places in their journey. So equality is not equity. People need different levels of support to get to the better outcomes. So we're really excited about some of the research we've done that we're now activating and helping clients and organizations in the community advance health equity and embed it into their business, so that it's not a side gig or side hustle, part of the main operation.
What do you think? And I want to get into some of the work that you guys are doing with these organizations, but why do you think our life expectancy is going down?
Yeah, I think it's an impact of a number of different things. One, I would say that it's racism and bias that are impacting the delivery of services. It's unconscious. it's ways that historically systems and structures have been set up, and they're also the ways that we finance, organize healthcare. So, right, many of the other countries around the world that have better life expectancy, you have a flip on their national health expenditures where it's more going into social services and than direct medical care. And so we have the flip. We have much more going to medical care than social support and services. And as we saw with the data, the 80% of health outcomes are determined by where people live, what their community's like, what food they have access to, if they can have transportation, their jobs, their social connection. We talk about mental health. COVID's illuminated this issue of health inequities and made it very bare, that it's clear. But it's also done another thing. It's suggested that if you've got employees as an organization, you're a health company, because of the impact that it has had both on physical and mental health. And so I think that lately the data suggesting the opioid epidemic, cardiovascular disease, other elements that are making it worse. But we go back to when there's systemic inequities, it can impact that issue of life expectancy and people's ability to live healthy lives and have their highest potential for health and well-being.
Yeah, thank you for that, Jay. And really drives the point home of health equity is a really key thing, not only to bring up, things like life expectancy, overall outcomes, but also a business's success, right? I love the framework that you gave us. What are you doing in your house, the business? What are you doing with your products? What are you doing in the community? What are you doing with your suppliers, right? The market.
Yep.
I love this. And folks, and Jay, by the way, this paper's available, right?
All of our
we can link it up in the show notes.
Yeah, all of our content's available.
That's awesome.
Just Google Deloitte Center for Health Solutions, Deloitte Health Equity Institute, and you'll find the content there as well.
That's awesome. Yeah, and folks, we'll link it up in the show notes so you could take a read. Because at the end of the day, it's like if one of these points resonates with you and you want to take it home, well, take it home and act on it. Because at the end of the day, there's a lot of good that could come out of the work you guys are doing with your companies and your organizations. So talk to us about some of the work you're doing with these organizations. You shared previously that you guys are even doing some pro bono work out there to help move the needle. Tell us about that.
Yeah, the Deloitte Health Equity Institute, we just celebrated our 2-year birthday, and it's been a great journey. And we've invested $25 million since launching the Health Equity Institute in 2021 in 50 grantee and sub-grantee organizations that are working to reduce health inequities.
Amazing.
And recently launched an initiative with the American Heart Association and the Society for Human Resource Management Foundation around getting to positive health outcomes for 10 million workers by 2025 across the country. It's a bold initiative. We just released a playbook for employers to use for the workforce and the communities that they live in. And we're really excited about that. And so, we have a theory of change that one is equipping key decision makers like your audience, with the data, tools, insights, actions they can take in their organizations to advance health equity. We bring fragmented stakeholders together around issues to act collectively together. We know that, again, every kind of stakeholder has a role to play. And so you need the public sector, the private sector, community-based organizations coming together. And we do this in maternal health. We do this in mental health. We do this in chronic disease and cancer. We just launched an initiative with the American Cancer Society around navigating patient navigation through both screening for prevention and treatment. And then we are also driving health equity innovation. So we're funding and engaging proximate social entrepreneurs to help set systems change into motion, to change the health equity landscape. That's why we've engaged 600 HBCU student social entrepreneurs in accelerator and on-ramp programs through our work with Echoing Green. We work with New Profit to support early stage organizations that are shifting the narrative around maternal health disparities, such as a Yelp-like app for Black and brown women to find and lead reviews on maternity care. We're working with Unidos US, the nation's largest Latino community-based organization that's working with their nearly 300 affiliates around youth mental health and addressing that issue. And then we also work with United Way worldwide to address racial disparities in infant mortality, low birth weight, maternal mortality. And again, we're just still seeing this issue be trouble. The infant mortality rate has gone up, in the first time in the last 20 years. And so we know that these issues require action today. Now, I would say for businesses and organizations, what also we are doing is helping the C-suite and their teams understand how they can embed health equity. So if you think about health care delivery organizations, provider-based organizations, health systems, community-based organizations, the lens through quality and safety, which hospitals and health systems know well, let's look at it with an equity lens. So what's the difference between men and women have diabetes readmission? And we've seen hospitals close the gap to zero from 10%. But just asking the question, interrogating your data you have, and then identifying the data you need. What can you do, with other players? We had 3 health systems come together, for example, to say, we're going to address this issue the community told us around unemployment. And as a result, supported 14 small businesses that not only impacted economic mobility, but then health outcomes. And I think food is the other area. We're seeing food pharmacies, we're seeing benefits on the plan side impact, food as medicine. And also this recent report we did with our Chief Health Equity Officer, Dr. Kalani Gabriz, and our actuary team, that women pay $15.4 billion more out of pocket than men on healthcare if they're employed. And that's, again, asking the question. So the difference is certainly disproportionate impact race and ethnicity, but it also impacts gender, veterans, given that it's Veterans Day today, and people with disabilities, people in rural communities versus urban communities. You could cut it and think about it in different ways. And for me as a clinician, the social ills of our community show up in my clinic, or when I see it, in the factory or in the home or in the community. We send people back to the conditions that make them sick. We could do everything right clinically, but if they don't have the right conditions where they live their lives and have access to things that help people be healthy, then we won't get to those kind of outcomes.
So many inroads to make an impact on this. The idea of food as medicine. We were recently talking to Kroger about some of the stuff that they're doing, and just across the field. Andy Davis, right,
Yes.
was on. We hung out at Health, and he joined us for that inequities with women paying more in healthcare. That stat you just shared, Jay. The entry points you mentioned are tangible, and the work that you and the team over there at Deloitte are doing it's very real. And I just want to invite everybody to take action as well on these ideas that Dr. Bhatt is sharing. What closing thought would you leave the audience with, and call to action would you leave them with? And then what's the best place they could reach out to you to learn more about the stuff you're doing?
Absolutely. Saul, thanks for this opportunity. And I would say one more thing about life sciences companies, important part of the ecosystem is that clinical trial diversity. You can, from my patients and from consumers and patients, they want to be involved. They're aware, but we've got to make it easier. We've got to help them understand, build trust, sustain trust. It's also unmet need. So triple negative breast cancer, for example, impacts Black women disproportionately. How are we addressing that? Sickle cell, rare diseases, thinking about, the issues around diabetes, heart disease, and cancer. I think that there's, really important ways that we're seeing life sciences companies lean in to health equity to address unmet need, as well as thinking about medical technology. And we saw this in the pandemic, that the pulse ox machine doesn't work as well on people of color. We launched something called Illustrate Change with Johnson & Johnson, Deloitte Digital, that is addressing the gap that there is around medical illustrations of people of color. Less than 5% medical illustrations represent people with darker skin tone. And so as a result, that has an impact on diagnosis. And I have firsthand experience with that, and delayed care. And so that's important. The other thing I would say is convergence, that there is an opportunity to think about this across industries, because, and making it easier for consumers to access what they need to be healthy. And they want easy, convenient, virtual and retail options. 1 in 3 people felt less prepared to handle health expenses at the end of 2022, citing inflation as the number one reason. And as of this year, we're still seeing some of those issues. And so, convenience, cost, but most importantly, feeling like they've been treated with dignity, respect, and can access what they need to be healthy is really important. And so I think we are at a tremendous inflection point, given the technology, given the tools, given ways that different parts of the industry and sectors are coming together with consumer health and tech. But we're also seeing, a challenging environment in the workforce where we've got to address the talent gap and make it easier for healthcare workforce to meet their mission. As a physician and in clinicians, we're seeing that as an issue. But we had a paper around the talent emergency that encouraged folks to look at to address some of those issues. But I would say, to close, the future of health can be one in which we reduce costs, we extend life expectancy, we close the gaps. But it's got to mean that we lean into restorative, preventive, health-oriented model rather than a sick care model. And health equity is part of that, but also orienting around what both the moral imperative is and the economic imperative, and running it through those domains of action I alluded to earlier. What are you doing in your own house? What are you doing through products and services in the community? And how are you impacting the ecosystem around you? That has an impact on, our mission is an equitable future of health for all.
Thank you, Jay. And appreciate that close. We'll leave everything that you discussed, the white papers, the resources in the show notes. And if anybody wants to follow you or get in touch, what's the best way to do it?
I would say you can find me at LinkedIn, at Dr. J Bhatt on Instagram, and at Bhangra J on X. But the easiest way is to go to our Center for Health Solutions website or our Health Equity Institute website, and you can find myself and the others on our team. I just want to say a shout out to our incredible team at the Center for Health Solutions and Health Equity Institute, and our partners and teams that I get to work with at Deloitte. Just feel like we're on this mission to make healthcare better for everyone, and I'm really excited about that.
That's great, Jay. Thank you for that. We're excited about it too. It's top item on the agenda, and we'll leave all the resources you shared in our show notes. So folks, take action, reach out to Jay, find out more through the work that they're doing at their amazing organization. Jay, thanks so much for being with us.
Saul, thanks for having me.